Now, if we were palpating the patient looking for AA motion, typically we would be looking in this transverse process area that's just below the tip of the earlobe here. But the tender point for this anterior C1 is not located right over the transverse process, but it's located at the mandible at that area, so you have to kind of push in right at that. So the angle of the mandible is down here, so it's not at the angle of the mandible. It's up just at the tip of the earlobe and very commonly gets confused with transverse process. So just remember you're on the mandible, kind of on the inner side of it. And once you locate and check for the dysfunction and then locate the tender point in there, you'll rate it as a 10 to the patient. And then you'll slowly rotate the patient away from the side of that tender point and recheck it. And if you initially registered that tender point for the patient as a 10, hopefully the pain is going to start to be reduced. And your goal is to take within the range of rotation without side bending how much you can comfortably attain and still be able to alleviate that tender point, hopefully to 0. Sometimes you could just lift the head up just a little bit. And then once you find that 0, you'll just gently keep the patient here, maybe at about the 30-second level. You can recheck just to make sure you don't have to reposition her and retune it. And then you wait the next 60 seconds to the full 90 seconds. And after that 90 seconds, you'll just very slowly bring the patient back to the neutral position and then recheck the tender point and see if it's improved.